got a few people I know that are running just a tad bit late, but we're going to go ahead and get started right at 5. So let's call the roll for now. Rusty?
Here.
Harvey? Rich? Dr. Harrell? Ken?
Yes, ma'am.
Dr. Pacifica?
Yes.
And myself. Okay. And the others will be joining us in just a few minutes.
So I'm starting this.
Someone's trying to beat their way through the door.
Yeah.
Let's see before we start the invocation. Is it Harvey?
It's Harvey.
Howdy.
Hello.
Hello, sir.
All right. Rusty, will you lead us in the invocation?
Sure will. If we all please bow our heads. Heavenly Father, we thank you today, Lord. We thank you again for this community that you've given to us. Lord, I ask that you would entrust us with this, the agency here, Lord, and that we would find our way, Lord, to fulfill your will with it. A lot of people in need here, Lord, in our community. We just ask that you'd open our minds and hearts up, Lord, to fulfill your will with this cause. Ask, Lord, that peace be with those who are here with us today, Lord. Watch over and guide and protect them, those who are not as well. Things in your name, we pray. Amen.
Amen. Thank you very much. Moving on to public comments. Do we have any public comments? Hearing none, we will move right into the previous minutes. Hopefully everyone utilized their new iPads to review the previous minutes. And if there's not any questions,
Move approval.
we have a first and a second. All in favor?
Aye.
Motion approved. Okay, Kurt, or Ken, you're in charge of the audit?
Yes, I am going to defer to Matt.
Well, this is a very exciting thing for me because usually we're the only CPAs in the office, out here. But we have Curtis Gray with us today to present the findings of the 2024 financial statement audit. Just a few reminders to the board of trustees. We're a fiscal year end, so this is an audit of the September 30th, 2024 financial statements. And this is the year which we transition from the business type activities, the enterprise fund, to full governmental fund reporting, which is a big change to the financial statements in presentation and accounting rules and geeky stuff like that. But I'll make sure you guys have any opportunity to ask Curtis Gray any questions about that. If you want, just remember, we prepare the financial statements. If you have questions about the statements, they can come my way, and Curtis Gray presents their audit opinion and management reports on our financial statements. So without further ado, I'll introduce Tim Westgate, partner at Curtis Gray.
All right, thank you. Good evening. I'll try to be quick. I understand you have a sensitive schedule this afternoon. Again, Tim Westgate, audit partner on the engagement. Allison Stone is the audit director. Thanks for the opportunity to present. As mentioned, it's for the 9/30/24 year end. This does meet your external financial reporting requirements under Florida statutes and requirements of the board as well. So you're meeting those. The main thing that you want to hear from your auditors is ultimately from the independent auditor's report, what's the opinion on the financial statement. So as Matt mentioned, management is responsible for the financial statements. Management is responsible for internal control. We're pleased as a result of our audit, we're issuing an unmodified opinion, that is a clean opinion, highest level of assurance you can have on the financial statements. The audit is done under government auditing standards, as in part of that, we look at internal control related to financial reporting. And we look at compliance matters that if there were material non-compliance, they would be findings in your report. If there were material weaknesses, significant deficiencies, item like that, we would report those in here. Pleased to say, it'll be a boring read. If you go through, you don't want an exciting audit.
He's right, it's boring.
Thank you, right? So all standard language in there. No material weaknesses, no findings. A couple other reports that are in the back. Required by the Florida statutes. There's a statute 218-415, and that is for investment of public funds, and we're required to perform an examination related to that, and the district did comply with the requirements of that statute. And the last one is a management letter section, and that is required under rules of the Florida Auditor General. If you had issues of deteriorating financial condition, weren't paying your bills, weren't making payroll, items like that, those would be included back there. But again, a clean report in that regard. So with that, I want to thank Kurt, Deborah, Matt, and the Crippen team who have to put up with us throughout the audit process, show us this, explain that, help transition the financial statements from enterprise funds to governmental, and we get great cooperation through that process. So thank you with that, and I'll open if you have any questions on this exciting material.
Any questions? Tim, thank you.
Thank you so much. Thank you. Have a good evening.
All right, you as well.
Need a motion.
Yeah, we get a motion.
Yes.
Ken should do it since he read it.
Yeah, okay. Well, some of us did read it. Us geeky ones read it.
As already said, I'll approve them.
Make a motion.
Make a motion that we approve the audit.
All right, we need a second.
Second.
We have a second. All in favor?
Aye.
Motion's approved. Kurt?
Okay, I'll be brief with just a couple things that I put into the packet, and I just want to breeze through a few things and then introduce our speaker. So just the first thing on there is there's an update on 211 services to the community. Just to recap that. Oh, here. When did I- Just to recap that, last year, we provided some gap funding along with the city, the county, and Department of Health in order to keep 211 services operating in Marion County. It was a one-time funding that we provided, and what I'll do is there's a lot of detail behind this, and I want to do it justice. So if you would, if you have any questions about the material that I presented here, please call me individually, and I'd be happy to go over it, because it's been about a 6-month process of getting to this point. So then also, just this weekend, we had a phenomenal community celebration at our community home project. On Saturday, there were over 30 health and social service providers at Howard Academy, and we hosted them, and it was really not only to bring in people from the local community so they learn what services are there, what health programs are available, but also the value-added benefit was we had lots of providers there that weren't even aware of each other. So they were sharing information, they were saying, wow, I wasn't aware that you have resources for veterans and that you have primary care in the local community that is accessible and affordable. So it was really to bring awareness, which has been one of our big pushes over the last year. We have so many services out there, now we just need to point the right people to the services and ensure that they have access. We had A1C tests and cholesterol tests, CPR demonstrations, and we had numerous providers that help with the social determinants of health to really help improve each individual's standard of living as well as position of health. Then we also, I wanted to point out, we participated in the most recent community health assessment session. So, is it every 2 years? Yeah, thank you. Every 2 years, there's a community health assessment, and it used to be done by the Department of Health, and now it's done by Advent Health and the Department of Health. They host it, and what they do is they bring together all these nonprofits and hospitals, the Department of Health, the city, county, and what they do is kind of an assessment of what services are available, and we look at data to evaluate what are the gaps. And then one of the most important things that we do, since we've been doing this for many years participating, we really do a deep dive assessment in the data, because a lot of the data is garbage. So, and for years, you'll see organizations or communities make decisions based on, well, this is what Robert Wood Johnson says, or some of these other major health data sources, and they never really do a deep dive. And so we do, and so that's why we participate, so we can evaluate. So they'll bring up things like, we have an issue with dental services in Marion County. There's not enough dental services for the uninsured. The only measurement that's done nationwide is based on per capita, the number of dentists to the number of people that live in your community. without determining whether or not they take uninsured, underinsured, or Medicaid. So we came up with a unique solution, such as our pop-up clinics and dental clinics, and that would never be measured in a national or state scale. So what we do is we bring in more data directly from our mind share, so the community can see these are the real gaps, and then what happens after the community health assessment, then it moves into a CHIP, the Community Health Improvement Plan. They use that data, they assess it, and then as a group we come up with a Community Health Improvement Plan that kind of creates a roadmap for all the organizations to work together to fill the gaps. And then I just want to bring up, we partially fund the students against destructive decision making. I always want to, it's a sad club. And it's really a group of future leaders and advocates for drug prevention initiatives, and it's all throughout the state, but we fund it here. And the great thing is, yes, I need to show you. We had a group of our local leaders from SAD go up to the Capitol, and they got to meet with legislators and discuss drug prevention initiatives. They actually got to engage with policymakers and really learned a lot about the process to bring drug awareness and drug initiatives to Marion County. So they're going to be great advocates as they go to the schools, and they also met one-on-one with Stan McLean up there. So it was a great opportunity for them to learn and bring back information to their school system.
And they're making a video for you all, so thank you for the funding. It's under your.
Who sponsors that group? Like the school system or?
So they get some state federal funding for some of the student against destructive decision through the community. So their CCSA, what does that stand for?
I can't remember. I'm sorry.
It's a federal grant also that they get. I think one of the,
Were they high school students though, or?
so middle and high school.
Middle high
students.
school? Okay. And they have an advisor or a teacher or?
They do
Okay.
have some advisor for the children's office.
Okay.
And then also, I just want to make you aware that we have a newer article in 352 today where their reporter asked me a series of questions about what does the hospital district do, and tell us about your role in the community. So they were very generous with their time, and they gave us considerable space where I could actually expound upon what we do and what collaborations we have in the community and what our focus areas are. So there's a link here, so feel free to click when you get home. And
Yours works.
oh, it does?
Work.
Oh, go ahead.
Okay, one of our biggest things of today is Brenda Robinson, one of our employees. She had her baby today.
Yay!
I
And
didn't.
you remember
But,
Brenda picture? So she had a little boy. We're not really sure how big he was or any of that.
But it looks good.
Everybody's healthy.
But everybody's healthy. His name is Benjamin.
Benjamin, hey, good job.
Aw.
Yeah.
And then, what I would like to do is introduce LaVon Goodson, who is the CEO of Estella Bird Whitman. And they were just honored as Nonprofit of the Year at the Inspire Gala, which is amazing, because in a very short period of time, Estella Bird Whitman went from relative obscurity. I mean, I knew who they were. A handful of people did, but now the number of community connections that Lavonda and her team have made have been tremendous. And I won't steal your thunder, but they have really expanded the scope of their helping services, and they're one of our funded projects. Yeah, I'll pull it up. Okay. No, just tell me, say
All right.
that.
It's
That's right.
Kurt's the clicker.
Yeah.
So good evening to everybody. I want to thank you all tonight for allowing me just a few minutes to kind of brag about what we've done in a very, what I feel like is relatively a short amount of time. Although the team hears me say that it took too long, but it was a relatively short amount of time. I stood here a little more than a year ago and, almost made some promises to you all without actually promising that I was going to make a change. This passion, this center is huge to me, and I thought, you know what, I can make a difference. So you all took a chance on me, and I just wanted to share tonight with you some of the success that we've had, primarily because you all believed that we could actually do it. You click. All right. So our year-end and first quarter overview, our first quarter we've had over 1,000 patient visits. I'm very impressed with that, although I feel like that's not enough. I think that what we did last year is not going to work this year. We have to keep moving the needle forward. And with 84 new patients added since January, I had to be reminded that spring break fell in that time. That is a very slow period for primary care all the way around as far as I can recall. Continued commitment from us to continue providing community-centered healthcare. I believe that we had a strong year-end finish. We have many, many new partnerships that I will tell you about here in just a moment. And as Kirk spoke to, we were named Nonprofit of the Year. Some of you may have been at that, and I was a little bit of a mess, as someone affectionately said this morning, but it was definitely a surprise because, the notoriety, the recognition, all that's great, but that's not why we're doing this. I appreciate what we did, and it really feels good to be recognized, but we get up and come back every day because we're making a difference. And it's really, the recognition comes from the patients. Coming in, being happy to see us, knowing that, when someone says, hey, I feel like I'm coming to family here, that for me, don't get me wrong, but that for me outweighs the Nonprofit of the Year any day. You may click again.
One thing you might want to put into context is just in case anyone was just joining us at the time, what do you do?
So I apologize. We're a primary care office. We provide the same services as that you would get in any other doctor's office. We see family, so from 0 to no more breathing, we will see anyone who gets into our clinic, regardless of whether they have money, don't have money, they're insured, uninsured, it doesn't make any difference to us. Once you come through that big red door, you belong to us, you're part of the family. And so we have kind of put a little spin on primary care in that we try to treat everybody as if they're a VIP. If people feel like you care, they will continue to come and take advantage of your services. And that's been a long time, something that we've kind of fought against because people have to trust you. And so we've developed that trust and we will continue to do so. But that's, in a nutshell, very nicely what we do. But we can't do it alone. We have many community partners, many of which the hospital district is funding. So we're very happy to be a part of that family. The Community Home Project, Interfaith, Marion Sexual Assault Center, we are working very close. SMA, we just signed an agreement with them to provide on-site primary care for that 60th Avenue location. But this is not an Estella Whitman problem, it's a community problem. And I appreciate the hospital district taking the initiative to fund those opportunities that are around the county because then we can together create a comprehensive approach to access to care. Yes, sir.
There you go.
Okay. So we were donated 2 vehicles that we're really excited about. One is used for outreach events to get us back and forth. Primarily, we use my vehicle and Heather's. And Heather's got a smaller car, but you'd be amazed how much stuff we can shove in the trunk back. But we went to the city last year and said, hey, this is what we could do with these vehicles. This is what our need is. We had some data because data speaks to what the need is, and so we were able to approach them and receive two vehicles. One of them, we participated in the clinic in 2 outreach events this weekend. We were both at CHP's event, which was a tremendous event, as well as the Marion County Days. So our team divided and conquered, so we wouldn't miss anyone there. We loaded up the truck, dumped off what I don't know if dumped off is the way you want to put it, but emptied out everything the night before for Marion County Days, and then I went the next morning, did a little stuff, and then we went to CHP, and then finished off the day at Marion County Days. We do have another outreach event that's coming up April 5th. That is a minority health event that is being hosted by Department of Health. We will use that same vehicle and trolley out there. There's a couple of pictures if you can click. So this is our bus, and I want to tell you a little bit about this bus because I don't have the picture up here, but I was pretty excited about picking up this bus. The city, this used to be a Suntran. It's an old vehicle, but it is like, you know, I gotta tell you, it's like a brand new Bentley to me. I've been playing with that thing for the last week. But our goal behind this is we have about right now a list of about 10 patients for sure that we know cannot make it to their appointments. We have made arrangements, we're on the Suntran bus line, and so they caught rides and so forth. But what we started doing when we were made aware we were going to get this is start trying to keep track of those patients, and that's just data. So our goal is to go and pick those patients up and bring them to the clinic so that they don't miss their appointments. Yes, we can do telehealth, but we're a people business, right? It's a customer service business that provides medicine, and that's kind of how we want to look at it. And so going to pick them up for their appointments, bringing them back to the clinic, having a schedule where they know they're going to be able to get to their appointments, it increases access and removes one more barrier for our clients. To go a step further, my plan is to use this if we refer or the Community Home Project sets up something where they can refer those patients to a specialist of some sort, whether that's career development or whatever the case may be. We will also go and pick those folks up and take them to those appointments. We have the bandwidth to be able to do that. We have to be strategic about the scheduling, but I do believe where there's a will, there's a way. The next one, I told Heather we had to pimp this ride out a little bit because when we got it, it wasn't the prettiest, but it was free. And so we had it painted, they filled in all of the little holes. There used to be something on the top that was affectionately deemed as an owl. We had no idea what it was. But we took it to the automotive shop, they removed that, painted it, had some, Andy Griffith tires on there. My dad went and brought some new rims and tires for it. And so this is our new, I'm calling this the Pitmobile. And we're very happy with it because it allows us to be able to do a little bit more. There's always that, not that I mind using my own vehicle, but if I ever want to get rid of it, and for those who, some of you don't know, some do, I love cars, so every couple of years I'm wanting to get rid of something. So the mileage is the problem. Improving access to medications. We're very, very excited about this because one of the other barriers is medication costs. And so I started talking with Dr. Willis. Dr. Willis was one of my first medical directors, and he and I have remained very close after that. And I said, listen, I've got this issue. Can you tell me how we can fix it? So we kind of kicked some things around and ultimately came up with this in-house chronic care medication program. What that will do is offer minimal costs for prescriptions for our uninsured patients. The folks who have insurance, they really don't have to worry about this because their insurance is covering the cost of their medications. But for those who are uninsured, we took a look, the providers gave me a list of what our most chronically prescribed medications are. We have ordered those, we are now loading them into the system. They will have to pay, but to give you an example, a 60-day supply of lisinopril or glipizide is about $2.50 for the patient. If they cannot afford it, we will still provide the medication and try to figure out a way to offset this. It is a cost for us, but the goal really is to get them to establish a medical home. And when people are, given resources, they get a job. They start to do a little bit better. They get on some insurance. They will remember how you treated them when they had nothing. And so we will roll that program out April 1st. And again, it's designed to remove financial barriers to essential care. Many people don't take their medications because they can't afford them. Some of our new partnerships, I spoke about those earlier. The signed agreement with SMA Healthcare. Robin and I feel like we might be sisters from another mister. And we really do care about what we're doing. And so having a conversation, Robin and I knew each other in my past life. And so when she came out to the center and met with us, we kind of danced around this a little bit, and their patients started coming over, and we started seeing them and transporting, and then they were able to get some funding, and by the grace of God, we will kick the doors open there April 15th, we're hoping. We thought it was going to be April 1st, but we've got a little bit more to do. But for sure, we are expecting April 15th, we will start services there, and that will become our second location. We do have a pending MOU with Marion County Sexual Assault Center, primarily to do the same things. We don't want to be everything to everybody. We do primary care, and if I may pat myself on the back a little bit, we do it well. And so that's what we need to focus on. We need to be connecting people to the resources that we don't provide, working with Ann from Freedom Dental, working with Interfaith, working with CHP. That's what we need to do. And so we'll focus on primary care and let our community partners focus on the pieces that they play. We've done, so trigger finger over there, I'm just going to tell you, there was one little thing, but it just basically, it's all right. Oh, okay. So we have referred more than 100 clients in the last 6 months over to the Community Home Project, and we're proud of that because, again, we believe in comprehensive care. You cannot just bring a patient into the clinic, listen to their lungs. Don't get me wrong, I love our providers. I love what doctors and everyone does. If I didn't, I wouldn't have been in this field for 25 years. I love medicine, but it's got to go a little bit further than just writing a prescription and listening to lungs. So that's where that is. Next. Grant activities and funding opportunities. So we were disappointed recently. In fact, last Friday, we were notified by the Sonati Health Screening Grant that is put out every year by the Department of Health. That grant kind of prolonged. It was due to release in October, and they kept pushing it back and pushing it back and pushing it back. And we did finally get notification that we were not selected, but I have already started working. It's a yearly grant. I will keep submitting until they're sick and tired of seeing my name. All you can do is say no. We also have 2 grant opportunities that we've applied for. One is a federal grant, that's with HRSA, that's a new access point. That is to become an FQHC. The key points behind an FQHC is that, as you can see, it's $650,000 per grant year, which would make significant changes in how we're able to practice. And they have, blanket FTCA or malpractice coverage, which is very costly. We're currently paying that out of our own operational budget, but if we were to become an FQHC, that would go away. Understanding that right now no one knows what's going on with the federal government, I don't eat my eggs until they've been scrambled. So we'll just kind of move along, keep moving along. If we don't get it, we don't get it. But if you don't try, there's guarantee that you will not get it. So we did apply. We also have a state appropriations request that's out that has been supported by both Representative Chamberlain and Senator McClain. Met with both of them extensively last year and this year, and so we shot a little bit higher this year, asking for $500,000. Again, we're hoping to get it, but working as if that money is not going to come to us. So those are our 2 biggies right now. Yes. Okay. Oh, I just love Kurt. Looking ahead, so we've got some 2025 goals that I think are pretty, they're pretty big, and I believe that, I shoot way up here. If we land somewhere around here, I'm okay, but if I only shoot here and we only make it here, I feel bad, because I feel like we could have, gone a little bit higher. We are looking to bring on a full-time medical doctor. We currently do not have a medical doctor who is seeing patients. All of our providers who are actively seeing patients are mid-levels or nurse practitioners. And we do have a medical director who is an MD, but she does not see patients, and I would like to bring on a full-time medical director and some support staff, maybe find a place down the road somewhere that maybe we could put them and let them be able to open the doors for more people. Don't get me wrong, I do have great appreciation for our mid-level providers. They've done a phenomenal job, but there are truly some things that an internist can do that the mid-level nurse practitioner is not able to do. So we're looking at that, and that's probably going to run us about $350,000, including all of the salaries and things we need to put in place. We also want to expand our pediatric services. We are a family provider. We have roughly about 35 new patients that are under the age of 18 for the last quarter. I would like to boost that a little bit. We're working on getting into some of the housing developments that are adjacent to our center that could be within walking distance or that we could transport. Also making some connections with the schools, getting in the schools with the school nurses and things like that to kind of let people know that we're here and see how we can grow that program. There are many children who walk by. I've made friends with many of them. They're now not afraid to come out and take apples and things from me. Somebody had to tell me that's frowned upon right out of the gate. So they do come by, and we did have a reading last year that we did with the kids. It was great. We had probably about 20 kids there, and I read an Amelia Bedelia book and thought I was in heaven, and the kids loved it, so we will do that again this year, but just looking to add pediatrics to our program services. We definitely are looking for some building expansion, approximately about a $500,000, easily $500,000. We have outgrown the building that we're in. Our current building, we cannot have more than 15 people in there at a time. That includes staff, and most days now we are pushing it very closely. We have some staff that work remotely, which is good, but if I need to be there, I've got to kind of make sure that we don't have too many people in there. I won't say this, but I will say that we will do what we have to do. Nobody gets turned away. We've made some changes to our lobby, added some benches because we only had seating for one person, and so we had to make some changes there to meet that growth. But we definitely need another building. We've looked at a couple of different places. One we really had our heart on, the Fish and Wildlife Commission, but they are using that building, and we understand that. So that dream quickly went away. We are still begging, borrowing, pleading, and bargaining with the city to give us some space over by Mary Sue Rich. But again, we definitely, if we could find a building, we have a meeting coming up next week, Wednesday, I believe, with some city officials to kind of talk about a building that we have looked at that hopefully can be expanded, and if so, we'll keep it in the neighborhood. I just want you to know that we can expand our reach, continue providing care and sustain operations. I don't expect for the hospital district to carry us from now until doomsday. But we do need help, and without you all, we would not have made it as far as we have been, because again, as I started to say at the beginning, you all were the first ones to invest in us, and I'm appreciative for that, amount of money that we received, and I just want you to know that we have tried very hard to do what you've asked and exceed your expectations if we could with the financial investment that you've made. Any questions for me?
Nobody dares ask you questions.
I'd just like to point out a couple of things. So I had the privilege of just stopping by the other day, and so I remember some of the stuff that was said. Tomorrow, that won't be the case. But so in 2023, y'all saw how many people?
In 2023, this organization saw 321 patient visits.
And then in 2024?
It was 2,823.
Okay, so 10-ish X. And your entire annual operating budget?
Is a little more than 500,000.
Yeah, and so, I mean, they do a phenomenal job with not a lot. So, just one. So when they're asking for $500,000 grants, that's doubling, the capacity or funding.
No, that's a good point. And, though our focus isn't so much primary care, we got involved together because we were looking for services on the west side of Ocala, and we wanted someone that knew the community and knew how to get into the churches and could work on diagnostics and A1Cs and help us with diabetes and also managing medications. So Lavonda stepped up with her team and with barely anything and grew it to this point. So you've done a phenomenal job of expanding and connecting to the community, so thank you very much.
Thank you.
Good to see you.
All right, do we want to, is Wilshire in the waiting room?
Just technically,
Okay.
Yes,
we're
sir.
waiting for my text.
We are going to move investment above operations.
Stop me, Madam Chair.
Sorry.
All right. Let's see. Participants.
Hello, how's everyone this evening?
Good, how are you?
Let's see.
Great, thank you.
You said money, right?
Please hold.
No, it's okay. I'll, host. Let's see. Get this out here.
There you
Oh
are.
my goodness. There's Evie.
Yeah. She just came back from maternity leave a couple weeks ago.
Right, sir. I made you
All right.
co-host, so if you want to pull anything up, the floor is yours.
Okay. Pull this up. Let me know if you can't see it. Evie, are you with us?
Yes. Okay, great.
Welcome back.
Hi, thank you. It's great to be back.
So, Evie, I think we're straight on. You'll cover markets of performance?
Yes, okay. So, U.S. equities were down in February. We saw that large caps outperformed small cap equities, and half of the sectors in the U.S. index actually posted negative returns. We saw consumer discretionary did the worst, while consumer staples on the other end did the best. And the fact that the consumer discretionary category tends to include more leisure products, lifestyle things, it could be a harbinger that consumer sentiment is actually decreasing, which, you know, as consumers obviously doesn't feel as good, but that would be a good signal that inflation is finally stabilizing, which we know is what the Fed has been looking to see for such a long time. If we move over to developed and emerging markets, both economies did post gains for the month, and core bonds were also up as treasury yields fell. Nathan, if you could just fast forward a couple to slide 28. I want to talk briefly about asset allocation and how you're currently positioned. And as a reminder, we show this chart to you all the time. The gray bars just show the minimum and maximum range for each asset class, and then the black line is the actual strategic policy allocation. And the main thing I wanted to point out here is that as you scan down the page, you can see now that most of your asset classes are essentially in that strategic range where we want to be. But our full transition timeline, as a reminder, does span to the end of fiscal year 2026. The one out of compliance asset class that you'll see denoted by that yellow caret for private real assets composite, that's coming from Greystone, and we know that that was a position that was incepted well before we began this transition to this new asset allocation. But we'll get a nice update from them and the other OCIO providers around this time next month when we're all in Ocala. Nathan, if you could jump to slide 34, I believe. And we'll circle back to the corpus slides that we just passed along the way once I finish up talking through performance here. The total fund performance, as you can see, was up 10 basis points for the month, so slightly behind that total fund benchmark. And essentially the portfolio was flat, and it's good to see that your defensive components of the portfolio did actually help to offset the poor U.S. equity market performance, and that's exactly how we would hope to see your diversification across the portfolio paying off for you. So that's one good sense check. In terms of the different provider performance, I won't go into too much detail, but some high-level color commentary. Truist was down 55 basis points for the month. That was largely due to manager selection and a bit of asset allocation. They were overweight to US, and their managers captured a bit more downside than the down market. So that effect just compounded to create that bit of loss. Crescent was down 14 basis points. That was more so an asset allocation story. They were a little more overweight to directional marketable alternatives, and that segment of the market underperformed as well, so that drove that. And then Greystone actually added 34 basis points of value, and they did pretty well in both the manager selection and the asset allocation category. Their US composite does have a little bit more of a value bent, which served them well for the month. And their fixed income managers also did, a little bit better than the index, so that came together and created a positive effect. And the results that I just discussed do bring the total portfolio market value to $311.9 million as of the end of February. And let me pause here to see if you guys have any questions about markets or performance before I turn it over to Nathan to talk about the corpus charts that I know we'll be revisiting today and the spending analysis.
No questions? Okay.
Thank you.
Okay. Thanks.
Thank you.
All right. So one updated exhibit in our performance chart from last time is this new portfolio market value versus the corpus and CPI chart. So it was rightly pointed out last time that the portfolio market value actually incorporates spending. So if we look back since the inception of this portfolio to 2014, as Evie said, there's a nice healthy gap between where the portfolio is at all of 312 million and where the inflation adjusted corpus is at 258. So that's really good to see. We have taken off the horizontal line that just showed the nominal value of the initial corpus at 192.8 million, but we'll keep this below the chart just to make the comparison easier on the eye. And then the second chart we've added, and this followed conversations with Matt and Austin at Griffin, just to say, and to reflect the fact that there was a period of time that the MCHD had a number of legacy costs kind of associated with the closure of those two hospitals and the payment of things like closing up the pension plan. So this chart really is intended to show the time period, shows the exact same thing, but it shows a time period that we've essentially been exclusively a grant-giving organization, and that we've had this 4% budgeted spend within our annual budget. So those are the two charts. Hopefully that's a little bit clearer, and again, kind of apologies for any initial misunderstandings that kind of came about from transitioning to these charts. So, with that being said, let me flick through to spending, which is the main item we wanted to cover today. And you'll remember there are really two things that we wanted this to cover, and there's two decisions that we'll be asking the trustees to make today. One is to change the methodology of how the 4% is being calculated. And then the second decision is whether 4% is indeed the right number. And you'll see some analysis today, but the recommendations that we have are, one, to move to a new 3-year moving average calculation for the next fiscal year. So the calculation to be done this summer. And then 2, to retain 4% as the right level of spending. So we move into the first item and the analysis which is done here. We've looked back over the last 4 fiscal years. You can see here in blue, if we were to have adopted this 3-year moving average or 12-quarter moving average methodology, what would the dollar amount be for each of the last 4 fiscal years? And how does that compare to the actual amount that was calculated? And what you can see over time is that essentially the numbers are the same. I mean, I do recognize that cumulatively there is a, what is that, sort of $280,000 difference. But mathematically, these numbers will essentially be the same. The thing that is changing is the how much the dollar amount on a year-by-year basis moves about. And that's what's shown on the next slide, where the red line is capturing, for example, the change from $11 million in fiscal year 23-24 to $12.14 million was a jump of 10.4%. And previously, we look back to 2020-21, in the middle of the kind of COVID drawdown, there was a big drop in the spending dollar amount on a year-by-year basis. By moving to a 3-year moving average, you really kind of tighten the bands at how much year-on-year spending is going to change. And so, you see this 5 and 15% on the right-hand side. What that's trying to say is, in actuality, there's been about 15% variance. 1 year we've been increasing spending by over 10%, and another year it's been dropped by 5%. Under this new methodology, you kind of reduce that variability by a factor of 3, so from 50% to 5%. And that's really the benefit of doing this. It's not to change the amount, it's to improve the stability. So that's point one. Maybe I'll cover both, and then I'll open up for any kind of questions. Because the second piece of work we're asked to do is to really recommend whether 4% is still the right number. And as I said at the beginning, it is. But this is why. And to do this, to understand whether 4% is the right number, you really need to understand what the expected return of the portfolio is, given our strategic objective or North Star is to try and achieve that spending rate plus the level of inflation. So what we've shown on slide 51 is to say when we put this asset allocation in place, we had an expected return of the portfolio of 7.11%. And so once you take off that 4% spending, you get 3.11, and then once you take off what the expected level of inflation will be over the next 10 years, you get to about 0.76. And think of that final number as your headroom, your buffer. Now, over the 15 months since we put this asset allocation in place and the latest available quarterly numbers, the portfolio has actually achieved a higher return than we initially expected. And so what that does is it slightly reduces the forward-looking expectation of the portfolio. And so our buffer, if you will, has halved roughly from 0.76 to 0.37. Okay, so that's point number one to kind of take into account. Point number two, and this is think of this as the Monte Carlo stochastic simulation, is we projected forward, the target portfolio over a 10, 20, and 30-year environment, and to say, we're spending 4%, will the portfolio, retain its value? And we show this in two ways. On the left-hand side, we're just showing it think of this as like in 2024 dollar terms. And so even in 30 years' time, the vast majority of 96%, which is the orange number, of outcomes are above $310 million. However, when we adjust for inflation, which is what our true goal is, we have about 58% of scenarios over the 20 and 30-year time horizon are achieving our strategic objective. And so that's really the number we're focusing on, is this 58%. When we think of stress testing the portfolio and saying, okay, well, if we were to spend 3.75% or 4.25%, what does it do to the likelihood of achieving our objective? And that's what's shown in this green and yellow table on the right-hand side here. You've got the 58.4% shown here at a 4% spend rate, which is the horizontal columns, and then the different time periods. We've got this is our base case, this is where we're at right now. So 55 to 58% chance of bullet success or achieving our objectives. If we were to increase that spending by 0.25%, you're still about 50, but call it your buffer or your haircut is a lot tighter. And then when we increase the spending to 4.5%, we actually have less than half chance, less than 50% chance of achieving our objectives. Conversely, and obviously this goes with common sense, if we were to decrease spending, then that probability jumps quite considerably, north of 60%, even over a 20-year time horizon. And so when we think about and kind of bringing this together, sorry, I'll go back to this slide for a second. When we think about, one, the number of local 501c3s, number of local charities that you are now partnering with, that we are now partnering with on an annual basis, that we have committed to continue to fund if they achieve their own objectives, we don't think there's much headroom, if any, to cut the spending rate. But given the expected return of the portfolio, we also don't think that there's much room to increase the level of spending. And so that ultimately leads to our recommendation to keep 4% where it is. The final piece of analysis is exactly the same Monte Carlo kind of simulation under 10,000 scenarios, but now we're just looking at spending, whereas at the moment we've got $11.4 million budgeted in for the current year's spending. The first chart looks at it in nominal terms. So, in 30 years' time, we would expect to be spending $26.5 million. Albeit the range is huge, just given the unknown portfolio value at that point in time. But when we look at it as an inflation-adjusted basis, because when we're buying whatever the services that will be provided in 2055, it's going to all of the goods and services and the costs are going to be according to 2055 inflation, not 2025. So we look at this real spending target, and we still think, and we're still projecting, that even on an inflation-adjusted basis, maybe not for the next 10 years, but as we move that time horizon out, actually we should be able to increase the number of 501c3s we're partnering with, or increase our spend with each partner.
Nathan, what do the colors on those bar charts represent?
They're the different quartiles. So, think of green as a very optimistic outcome. Think of red as a very pessimistic one. And so, slide 55, this is really our conclusion, and just to also try and spell out exactly what this would mean. So first recommendation, does recommend changing the methodology from a point in time to a 3-year or actually a 12-quarter moving average. And so we've just shown here exactly which we would be taking 12 market values of the portfolio in order to calculate next year's spend. And then recommendation number 2 is to retain the 4% spending rate. I'll rush after that.
So if we were to compare ourselves with other companies, foundations to ourselves, how would this 50% success rate measure up? Is that something that's in the middle, fairly conservative, very aggressive?
I think, when we look at where you are versus the peer group, both in terms of what your spending rate is and both in terms of what your expected return is, you're pretty much in the middle.
Okay.
We don't have an overly aggressive investment policy where we have, 30-35% of our investments tied up in private markets, but nor do we have half of our portfolio in cash or just high-grade bonds. We're balanced.
So most of our peer group, if they're at a 4% spending rate, they're going to fall in that 50% success rate over 30 years?
Yeah, I think the one thing maybe that you're slightly above I would say, average. Because really, where all this, to answer your question, it really depends on how other clients are actually invested.
Right.
So I think on one hand, we've got a healthy allocation to some areas of private markets. That's probably around average if I were just, look at private equity and private credit. I would say where you're probably different to the average is you have a higher allocation to core bonds and a lower allocation to public equity. We don't think that's a bad thing, but I think that's where you're a bit more distinctive.
What's that?
What's our next step?
Did you want to cover your second recommendation?
Well, that's it, Teresa.
Okay.
But really,
Fine.
the first one's just the methodology. So currently, Marion then gets the custodian statement that shows the August 15th market value and calculate 4% from that value. Our recommendation is this year, this will be effective, I guess October 1, looking for Matt for confirmation here, is we would change that to these 12, the average of these 12 portfolio values.
Matt, do you have a comment you'd like to make regarding this? Because I know you've worked with Will Sharp.
Yeah, I think the thoroughness of the presentation shows you the amount of work that went into this, and obviously Nathan did a much better job describing this than typical accountant could. But I thought the most telling item in the whole thing was coming out of COVID and still seeing the bar charts. I have it as page 49 of the whole presentation, showing how similar their calculation to ours was. That really highlighted to me that the 4% number was probably pretty right. We've endured quite a bit in the market those periods of time. And yeah, I was always in favor of a longer period of time
Smoothing of the
versus
spin.
versus a single data point in time.
Yeah.
Do we need a motion?
Madam Chair.
Yes.
May I make a comment? First of all, I want to commend the board for having this work done. As somebody who has been in this, not in and out of this position since before the lease was signed and knowing that we had the money, and then getting the lease signed and getting the district set up and having this corpus put in, I can tell you that one of the initiatives of the commission, one of the things that we've always wanted to see too, when it comes to this fund, is to see that corpus protected. And I think that each one of you that have ever had to sit through an interview with any of us before you came onto the board, that was probably a question that you were asked. So I commend you for doing this, and think that this is it was a great presentation, and certainly hope that you will all vote to follow the recommendations.
Thank you, Kathy.
So we need a motion.
So,
I've got one question. So Nathan, one of the issues that I know that we dealt with when we were doing a point in time is we've got some investment vehicle that's hard to put a number on, right?
They can lag 6 to 9 months.
Right, so my guess is we'll still have that issue with the most current quarter or current couple quarters, but the ones 3, 4, 5, back in time, those will have a value that we can impute to that investment. So it cleans up that aspect of it?
Yeah, it doesn't completely remove it, as you said, Ken, but it highly mitigates it, given that I know there are some that are 9, but honestly, 95% of your private market program should only be 3 months lagged. And so when we, if we're using 12 values to calculate what this 4% budget is, 10 or 11 of them should have finalized numbers.
Okay. So that's another good thing.
That's another good thing. Yeah, you have more confidence in it. Now, as Matt said, the numbers actually aren't that different, and we were somewhat surprised that they were so similar. One thing to note during that, and it is that during that period, we've only really had a 5% allocation to private markets. We're working our way from 5 to 15 So were we not to make this change, it could be that that difference would become bigger. So there's even more reason to do it.
So that's a good point, Ken. So that being the case, do we have an established procedure or policy how we account for that missing information when we're doing that calculation?
So the standard valuation policy is that private market, and this is the case not just with yourselves, but frankly with any non-profit organization, kind of permanent capital is to lag private market investments by 1 quarter. Some do it by 2. But that it's just industry practice. It just reflects the fact that, you know, take private equity as an example. This is ownership of companies that are not listed on an exchange, and that it takes about 8 weeks, sometimes 10 or 12, to get a valuation of those companies.
Okay, so when we do our calculation, I think you gave an example, you give supporters with those calculations are met or calculated, and we're lagging 8 weeks out, do we just wait for the 8 weeks to get the information to finalize the number, or are we just gonna?
I think that was the policy, is that we're just gonna take the number that was.
The last quarter number.
Yeah, that's just, that's what it is.
Okay. And that's our procedure, right? Okay.
Yeah, again, half looking to Matt here, but I imagine, you know, the timings of when the trustee board would be discussing what the dollar calculated value is would probably still be in August and September. It's just that, you know, we'll be calculating on 12 values and, you know, the confidence we have in the accuracy of it would just be so much higher.
Great.
Other questions?
Do we need a motion?
Yes, we would need a motion.
So I move to accept this initial recommendation for 4% to portfolio value, and also use that 3-year moving average calculation going forward.
Okay, we have a motion. Do we have a second?
Second.
We have a second. Any other questions? All in favor?
Aye.
Motion passes.
Good work, Nathan.
Yeah.
Very good.
Good.
Thank you, everyone. The one final piece I'll stop sharing, because as you saw, there's nothing else in the meeting pack. We'll be delaying the OCIO dashboard to the in-person meeting. The reason is there's ongoing legal discussions about the information that we require the OCIO providers to give to us. And we just need to make sure any agreement that even Wilshire enters into on the OCIO with the OCIO managers is suitable given Sunshine Law.
Understood.
So probably my only ask there is that when EP and I are in the room in April, it'd probably be an easier conversation if we went after the OCIO managers rather than before them.
Okay. We can arrange that. All right, anything
All right.
else for Nathan or Evie? Thank you
Thank
both
you.
very much.
Thank you.
Thank you.
Yeah.
Take care. Bye.
Bye.
Let's move on to operations.
Thank you, Madam Chair. You should have in your package there, and most of you are aware, we are, and thank you, Harvey, for taking this project on. We are in the process of expanding the parking lot, our Beacon Point on the north side there. Those that have been there, know that grassy area there. The plan is to go ahead and pave that to a parking lot. We now in front of you have a agreement with the engineering company, which is Kimberly Horn. I think for their permitting and for their consulting work is $28,500. That does not include anything for construction. But given the size and scope of it, I'm not sure we need them for construction admin work. But that's the plan, is to.
Move forward with that.
Yep, that's my recommendation.
Do we have questions regarding this?
Is it been approved already, or is this for approval?
No, we're going to need a motion to approve it. Yes, ma'am?
The expenses related to this parking lot project were budgeted,
Yeah.
so they are available funds.
This is a finite requirement, there's no addition to this engineering project, 28.5.
25, yeah, that's it.
That's just the permitting.
That's permitting and engineering services,
Does
yes.
that mean the cost of the?
Because I saw some-
No, that's what, that'll come to letter date to us.
There would probably be a little bit of cost from that because you always run into something. So to say that we're done with it, probably not.
So do
But it's
we,
good, it won't be much.
What's in the budget for it, Matt?
Beacon Point has total capital outlay of $270,000, of which the parking lot was gonna be a substantial portion of it, so I have to.
Do we know how much that was allocated for?
250.
250.
I was gonna say, I know it was most.
I mean, how much allocated for
for
soft cost?
this, yes.
Oh, I don't know.
The total cost is 250.
It's
Is that still a good number, Mark?
No, that's fine, it just,
Okay.
I was just making a comment that basically, Kimberly Horn may have to spend a little bit at the end, maybe out of the bill at the end, because when we go to get our permits finalized, they have to sign off, so.
And to Harvey's point too, I mean, there's this task 3, if you look in the contract, basically they give the option to, for certain services over and above, to meet with the contractor to supervise and bill us hourly.
We can
Yeah,
do-
there was an
we can
hourly
do-
basis, that's what I was asking if it's final.
It's pretty close, I mean,
I don't, like I said, I don't think at this point in time we're gonna engage them to do any kind of construction admin stuff, really it'd be some hourly stuff that's.
And then
based right
sign
here.
off at the end.
Yeah.
I make a
So
motion
should-
to approve.
Yeah, I second that one.
All
Okay.
right, we have a first and we have a second. Any other questions? All in favor?
All right.
Aye. Motion
We
passes.
go ahead and bid for this parking lot now?
We will, as soon as we get the plans finished. They'll reach out to bidders for us.
And then we'll come back to this body here for ultimate approval of construction.
So we have a budget of 250 out of this. 28 is going for this one, so we have got 220 left.
Correct.
So we expect that to be accomplished in that budget.
We hope so.
Hope so.
They did a budget for us, based on current prices change significantly.
What was it before?
I mean, that's what they came
Oh,
up
that's
with
what it came up with.
when they did a budget.
That was
for us.
what their cost.
What they estimated that.
Got it.
But in all fairness, I mean, this, we first started talking about this thing years ago, it was $500,000. So.
We shrunk it down a little bit.
Yeah, Howard came in and
Not
helped
as
us.
much. We'll be all right.
Thank you, Artie.
Thank you.
Thank you.
Yeah.
Anything else, Steve?
Is that also going to solve the drainage problem there?
Okay,
Okay.
we finally figured out what was going on with
Okay.
that nice pretty inlet at the corner of the
Yeah,
parking lot.
yeah.
It goes nowhere.
Okay.
It's just there for looking.
It's a show.
It was so they could get their permit approved.
Okay.
We need an inlet, okay. I need to go to a pond. We don't have a
Anything
pond.
else?
That's
Okay.
it, man.
All right, Stephanie?
So SMA was awarded the Florida's Criminal Justice Mental Health and Substance Abuse Grant. And this is to help Marion County residents at risk or involved with law enforcement who have like substance abuse and mental health disorders to keep them from being incarcerated. And they have $50,000 of unspent funds this year, and they would like us, we would like to have a budget amendment to change the $50,000 towards this, they need a match for the grant.
So we're
Did I
not
say that right?
spending any more money, we're reallocating.
Yeah,
How it was
reallocating,
previously
yes,
approved.
that's right, exactly. Yes.
And if I could add, so the $50,000 will draw down another $50,000 from outside the county, so we can do this planning grant that really is a diversion program tying together the court system with behavioral health. And there's many diversion courts that are in Marion County, so this will add to that. And the great thing is, once they're done with this, and I think it's a year of planning? A year of planning, then if they're successful with their plan that they submit based on this, this 1 year period, they could qualify for a $4 million grant over 3 years to actually provide the services that they say are needed in Marion County. So this could add to a greater leverage for us for investment.
So seed money,
Yeah.
If we get 50, they get 50 for the reset, so.
So all we're doing is reallocating what was previously approved in our budget of $50,000, not spending any additional funds.
Right.
If everyone is, we would need a motion to approve this reallocation.
You guys are in favor, obviously.
Yeah.
Motion.
We have a motion, we need a second. We have a second. All in favor?
Aye.
Motion passes. Thank you.
And Kurt is going to take the opioid abatement.
Okay, I have a document here, page 59. So, we actually have the chair of the opioid settlement committee here. So, just a reminder, so the hospital district was brought on to manage the grant funds under the opioid abatement committee. So, we have no decision-making capacity as a board or as staff regarding these funds. We are just here as the opioid settlement committee, which is a separate committee under the county, or actually under a regional plan, that basically they pick out what projects they want to fund, and then we manage it just like we do our traditional grants. So this is just an update that there's 2 primary projects that the opioid settlement committee approved already, and the hospital district is engaged in the contracting with and working on the funding and evaluation of the status of the projects. The first one is one of the most important to Marion County that we can have, and that's the establishment of the central receiving facility. And that name really doesn't do it justice. So the funding will help pay for a facility, but it incorporates one of only 13 in the state's central receiving systems, where SMA will become the hub of all of the beds for detox and crisis management, and they will determine the allocation of where people should go based on the needs of that individual. As of right now, the system's a little bit like the Wild West, where an emergency room will receive someone who overdosed or is presenting with a substance use disorder, or fire rescue will pick someone up, and it's up to them to decide where the individual goes. They're calling around trying to find a bed. That whole system will flip, where the central receiving system, or SMA, will do the evaluation, work with the hospitals, work with the first responders, and say, based on the medical conditions and based on the substances, here are the places where you should take them within the county. Do they have insurance? Do they not have insurance? And it really will smooth out the system significantly. And
But the individual goes to SMA first, and they work the case. I mean, to the cop, fire, first responders, whoever, they just go and drop them off at SMA, and then SMA takes it from there.
yes, unless they overdose, they have to be medically cleared first, and then once they're medically cleared, then they will be taken to SMA, and then it will be up to them. So it won't be a sheriff, it won't be OPD, it won't be a first responder driving them around trying to find a spot. It'll be SMA's responsibility to keep them or transfer them to best locations.
Is that a pretty big cost saving to our community? I know it's more efficient for us, clearly, you can get into the right care.
It will definitely be a cost savings for first responders' time.
Yeah, yeah,
They're
okay.
not locked
Is this
up
a 24-hour
transfer.
operation?
Hmm?
Is it 24-hour operation?
Yes.
And that's actually a physical location,
Yeah.
or they just make a phone call?
And that's what this is paying for. The opioid settlement committee agreed that they would help build the facility that's required. And then once the facility's opened, we will draw down funding as a county. And I can't remember what it is, but it's a little over $1 million a year of additional services that we will receive just for crisis stabilization under the central.
So these ambulances actually go to the center to get directed from there, or is that, I'm not saying it operates?
So they will, let's say law enforcement goes out and responds to an overdose, they will contact the central receiving facility and they'll figure out how to direct.
So it's not a physical, it's a phone contact.
It starts out potentially as a phone contact and then it can transition to a transport if they are medically cleared to be able to do so.
Mhm.
It could be somebody that's having a mental health crisis that needs to go directly to
Okay.
the central.
Commissioner Brown had
Yeah, and I was trying to find our numbers over the next 20 years of what that settlement, and they go up we found out we had some more money coming, but if you haven't had a chance to get to know SMA, I highly recommend you do. The work they're doing is just 500% more than the previous provider, and they are really closing the gap in our community. They just opened a women's and infant facility out in Marion Oaks, which they already operate one of those over in Bunnell, I think that's where it is. And they went after a grant outside of the committee. We were waiting to see if they got that grant to make this happen. I mean, they're just above and beyond what we could have ever imagined. And they're providing the service that there really was a huge gap for quite some time. And so this will bring it all together. It'll close all the gaps in the service when they have to drop someone off when they're in crisis.
That's why we invest so much into them, because they leverage a lot of funding coming into Marion County. So they've been the multiplier effect in terms of our dollars. It's one of the largest we have through SMA, because they not only have, they're in 6 counties, so they have a lot of clout when they're working on projects, and they've been pretty successful in others. So it's not pie in the sky when they say we're going to do this, because they have examples in other counties that could say, well, man, work there. So they've been a great partner.
And their leadership is incredible, because they all truly believe in what they do. In fact, their chief medical officer came to the CHP event and was sitting talking with individuals that were coming. No one had a clue she was their chief medical officer. She was just sitting at the vendor event with everybody else. And then they were like, well, I need to see a doctor. She's like, well, I'm the doctor you see. So it speaks volumes of the culture that they've created there.
Any other kids on that? Anything else? Okay, thank you.
And we really appreciate you guys taking on
The management.
the management of that. One of the biggest reasons we asked was because you already had the infrastructure in place, whereas the county didn't.
Thank you.
Most fun part, Matt?
Dessert time.
Okay, so included in the packet, beginning on page 60, is the interim financial report for the month ended February 28th, 2025. Again, the balance sheet presentation, our most significant asset is the investments, and associated earnings associated with those investments are what drive the operations of the organization. Unfortunately, though, for the month of February, it was down. The market was down a little bit, so there were a little bit of investment losses. I don't think it's gotten much better this month either, but according to the previous presentation by Wilshire, I don't think we're at risk of losing anything based on these little dips. So I didn't mean that to be a shock to the system for anybody, but just as you would see, the asset balances remain fairly similar. They can grow like they have in the last several months. And the results of operations are that we are still in line with all of our budgets. As we sit today, today is the end of the 6-month period of our fiscal year. So we're about halfway, and through February we're on track for budget, and same through March. Any questions about the financial statements? If not, we can see.
I guess that $6 million in cash, is a timing issue?
Yeah, so it's the opioid settlement funds being deposited.
Okay.
That's a significant chunk of it. And then we build cash up as we head into our quarters for the funding of our projects.
Other questions? If not, we need a motion to approve the financials.
So moved.
We have a first, we need a second.
Second.
Okay, we have a second. All in favor?
Aye.
Motion passes. Thank you, Matt. Any old business we need to cover? Okay, open discussion. Anybody got something they want to share, bring up?
Just real proud of the team. I stopped by the CHP thing this weekend, and everybody was out there. I didn't get my blue shirt, so I'm sure I'll
We're good. I'm in the back.
But no, it's really cool. Seeing the passion and the commitment to what this group is organized for, that the staff has for the mission. And so, just like hats off to the. Oh, he does smoothies and hot dogs. So.
It was
And
very
you
well
were
put
tying
together.
down some balloons for us. We appreciate your engineering skills.
Yes.
They came in very
Thank
handy.
you.
His parents will be proud to hear that.
There, how many, when I was out there was quite a few people there. How many did y'all expect? How many did you think
I
came?
think we had over 140 individuals, children that came, that knew
Mm-hmm.
people that were coming to the event, so.
That's wonderful.
Seems underattended probably for the effort that went into it.
Well, Marion County Days were also going on at the same
Oh, no,
time.
we planned our event and then learned about numerous other things going on at the time, so it was a great timing. And we're gonna evaluate, could we do like a block party or something different next year?
Just so you know, Marion County Day is always. Last Saturday.
That's
Of
on our,
March.
that's on.
Well, apparently we didn't know that, but.
Future planning.
Now we know.
We had over 12,000 people come.
We'll just do it that.
Yeah.
That's awesome.
We'll just
Yeah.
blend into their event.
And
Yeah.
then we,
Do we have anything else to cover? If not, we're adjourned. Thank you very much.
I want to reintroduce myself.
Things are great.
Everybody